I'm Dr. Galina, neurologist, and today I'm answering whether SPECT scan is a way to diagnose ADHD. Now, SPECT stands for Single-Photon Emission Computed Tomography. Mouthful. It's a nuclear imaging test that uses a radioactive substance and a special camera to create 3D images of the brain's blood flow and activity. So, while SPECT scans are fascinating research tools, they're not actually recommended by major organizations like American Academy of Pediatrics or the American Psychiatric Association as a diagnostic tool for ADHD. The gold standard for diagnosing ADHD remains a comprehensive clinical evaluation. So this includes detailed behavioral assessments, a thorough medical history, and input from multiple sources like caregivers, parents, and teachers. These methods are the ones that have been well established and supported by decades of research. And it's also important to note that SPECT scan involves radiation exposure, as it requires injecting radioactive tracers into the bloodstream. So while radiation dose is relatively low, medical ethics emphasize minimizing exposure unless there is a clear medical benefit supported by strong evidence. There is this principle in radiology called ALARA, which stands for as low as reasonably achievable, meaning avoiding exposure to radiation that does not have direct benefit to you, even if the dose is relatively small. So if you're seeking an ADHD diagnosis, start with your primary care doctor or a qualified mental health professional who follows established ADHD diagnostic guidelines.